I have been reading about a doctor. You know, everybody, we kind of take a doctor for granted. They will take care of us. We go get them when we need them. Well, let me just read you a couple of things, and you are going to meet somebody very, very special. You're going to meet a doctor, General Surgeon Dan Scoppetta, Dr. Dan Scoppetta of the Bristol Hospital Multi-Specialty Group. 25,000 surgeries, 35 years at Bristol Hospital. General surgeon, a prominent surgeon, yes, and he's hanging up his scrubs and retiring. Not really. I have been reading something about the doctor and what he has done in other countries, especially Haiti. And we're going to talk about that and talk about what it's like to be a doctor and what it's like to keep on working. Dr. Scoppetta, a pleasure, an honor to have you on my program.
Back at you. I feel the same way. It's a real thrill for me to be here.
You know, and when I was reading about you, I was reading about Haiti. And how many times have you been in Haiti?
I've been to Haiti 5 times, and I've been to the Dominican once, so 6 times.
But you know, the story that I read, I'm going to quote from the story for my listeners, and these are your words. I'm sorry, this is a little emotional for me. This is what you said when you were doing this particular interview, and you were pointing at a map in your office, a map of Haiti. And then you said there were 2 big surgical wards, one dark room and one with light. Out of the dark room came a woman. She had a large breast cancer that was out of control. It was untreatable. And she had a smell from the wound. No one would go near her. But you did. And then you went on, when you were doing the interview, to say she was so grateful that I was willing to touch her. I blew my mind. I knew at that moment I wanted to be with her. This woman touched my soul. That's, you got tears in your eyes now.
Here we go.
I know, but you know, doctor, this is what it's all about. When I read the story, and I had one of our sales folks, Ann, tell me about you, and this is the reason that you are here today. Now, I understand that you are going back to Haiti. Is that true?
Yes. My trips to Haiti were with the St. Francis Mission Group that's run by Dr. Michael Bork. They're a wonderful group of people. And they go to a village on the coast called Des Marie. Well, halfway between Port-au-Prince and the capital, which is the capital of Haiti, and the Des Marie is a halfway point where we take the plane into. And that city is Jeremy. Okay, and they have no general surgeon for a population of 300,000 people.
What?
Yes, I know it seems unbelievable.
No general surgeon?
No, and that's the hospital where I met this woman, okay? I was at that hospital. I wanted to see what they had for facilities. I was going around, and they brought me around, and chance and the good Lord brought me to meet this woman, and that experience, and that was a couple of years ago. I said, someday I'm going to be back here, and I'm going to do something more than what I did. And the opportunity came up about a month ago. A wonderful woman who's a nurse anthropologist who's actually from Bristol, who moved to Haiti. She's been there for 40 years. She married a Haitian man. She's an incredible person. Her name is Betty Gabrion. She's an anthropologist and a nurse. She called me or emailed me and said, would you ever come back to Haiti? And I said, Betty, for you, I'll do anything. What do you want? She said, well, you know what? The hospital now wants surgeons. They've asked me to find some surgeons. Will you come? I said, Betty, I've been waiting for 3 years for this phone call or for this email. Of course I will. And so now I'm in the process of organizing a mission trip there, going down at the end of the month to size things up. I have to meet the administrators. I have to look at the facilities to see what we need. But I know what they have. They have a functioning operating room. They have a lot of the equipment that's possible for us to do what we want to do. So I'm going to organize the first mission either for the end of this year or the first part of next year. And a mission goes something like this. It's usually like for a week. You assemble a group of people. You need an anesthetist. You need qualified nurses. You need people for recovery. And you need surgeons. So, you need a team of about 10 people to go down. And I've got the people. Now I just got to make sure where we're going to is ready to do what we need to do.
Now, when you get there, you have been there before, and you have seen the situation. I cannot believe that just that surgeon for so many people. I mean, how do these people survive, Doctor?
They don't, Brad. When they have some of these illnesses, they just die of things that you can't, that in our country here, you'd never get that far. You'd be treated. These people they just die of things that you can't imagine.
So now you are going to be going back. How many times will this be now for you?
This will be my sixth time to Haiti.
Sixth time?
But not to this place. This is a totally new operation or a new project that we're starting.
Uh-huh.
Yeah.
But you've been to Haiti that often?
Yes. I've been there 5 times. Yes.
Now, is there a lot of surgery, Doctor, that is needed?
If I could recruit 100 surgeons, Brad, I could keep them busy until they screamed, I want to go home. The need is beyond belief.
See, really is. Up here, we don't even think of that.
No. And, my view on this is that Cuba's 90 miles away from our coast. Haiti's not that much farther than 9 miles away from Cuba. These are our neighbors, I view them as our neighbors. They need our help. It's one of the poorest places in the world. It truly is.
Now, have you, when I read your background, how you got into medicine and everything, and there's no question, to me, I truly believe surgeons like yourself, God gives you a gift. I mean, you can go to medical school, you can do all these things, but you're given a gift, and evidently you believe you have to use it.
I believe I have to give some back, a lot back. I've been privileged. Okay, I've had incredible good fortune in my life. I had an excellent education. I'm a Connecticut-bred guy. I went to Notre Dame High School. I went to college at Harvard. I went to UConn Medical School. I was lucky to get in there. I thought I was going to be a primary care doctor. And the first time I saw a surgery, I said, this is for me.
How did you... I was going to ask you that. Why surgery? I mean, I look at you, and you're a doctor, you're a surgeon. I mean, that is a talent.
I can't tell you. But all I can tell you is that the first time I saw a surgery, which was at the New Britain Hospital when I was a medical student, I said, this is for me. This is what I want to do. And I never looked back. I did my surgical residency at the Hartford Hospital. I believe I've had an extraordinary good education. And I practiced in Bristol, since 1981.
Some of the numbers, 10,000 major surgeries, 15,000 minor surgeries, 126,000 office visits. I mean, incomprehensible here.
I know. When I sat down and looked at it that way, calculated those, I was surprised too. I mean, the numbers, if you stay around long enough, the numbers build up, as you know.
Oh, absolutely. And you're not going to retire, are you?
Oh, no. This is...
Thank God.
I view it as changing gears. I'm not going to have the active practice of the Monday to Friday that I had over the years, but I'm going to start doing the things that I love to do. I'm the medical director of our wound care center at Bristol, and I'm going to continue that one day.
A wound care center?
Wound care center.
Describe that to me, to my audience.
The most complex wounds that people have, either from diabetes or from injury or from vascular problems, end up on our doorstep at the wound care center at Bristol Hospital. And we've that opened like a year and a half ago. We've had very excellent success there. We also have the added advantage of having hyperbaric oxygen therapy there. So
now, what is that?
That's the use of very high oxygen levels for healing of wounds, particularly diabetics that have problems non-healing in their feet. That sort of thing is the most common thing that we address. But we look at any unusual type of wound and take care of it. So we see maybe 30 to 40 people a day there.
Really?
Yeah, it's a very busy place.
Now, how long do you plan, when you get this whole group together that you just told my audience about, how long do you plan to be in Haiti?
We'll start with a 1 week or 7 to 10 day a mission, okay? And then as time goes by, they may be longer. They may be 2 weeks. But it's hard to ask people like a nurse that's working in the recovery room to give up a week of their vacation to pay the expense to go. I mean, it's a big deal, so it's a restricted period of time.
Do you ever think about going down there yourself and staying for a while?
Brad, I don't want to admit that I do think that, because when I go home, I may not be able to get in the house.
I just know you. First time I ever met you, but just to look at you and hear you, I mean, you can tell where you're coming from.
Yeah.
That's wonderful. That's fabulous.
Yeah. Well, thank you.
And were you young in your teens when you decided that you wanted to go into medicine? How did it happen?
Well, I think in high school, through my, I guess I have to say through my Catholic education from third grade on, I was told to you got to give back some, you got to help out, and I thought I was going to be a teacher out of high school, and I wanted to help people, and when I got to Harvard, I went pre-med. I was and pursued that. I was, like I said, I was lucky to get into the University of Connecticut Medical School, and from there, I didn't do primary care, which is what they thought I was going to do, and I ended up doing surgery.
General Surgeon Dr. Dan Scoppetta of the Bristol Hospital Multi-Specialty Group. And he's not going to retire, and I'll get back to my conversation with him in just a couple of minutes. Stay tuned. A very special guest, General Surgeon Dr. Dan Scoppetta of the Bristol Hospital Multi-Specialty Group, who has been a surgeon for 35 years at Bristol Hospital. As I mentioned in my introduction, 25,000 surgeries. But he's more than just at Bristol. He's been to other countries. Haiti, he's been there, and he's going back. You just heard what he said. Doctor, one of the things that has always fascinated me about your profession, there are certain folks like yourself who it becomes their life. And that's the way you are. You can tell the way you talk, and it must be unbelievable to go into these places and to see the suffering.
In other countries is what you're speaking of.
Yes.
Well, I've been to Peru, Ecuador, Haiti, of course, and I've been to Nigeria, and it is very interesting to see the different lifestyles, the different civilizations, and most of the places where you end up going on mission work are very poor countries because they need the help. But Haiti, is the poorest that I saw. Nigeria was pretty poor as well. But
how do they greet somebody like you, your team
in Haiti?
Yeah,
pretty well. Usually, you're hosted by somebody, and it's usually a significant person in the community. In Haiti, there's a gentleman named Pierre Antoine and Dame Marie, who really is the mover and shaker in that community, and he organizes it well, so that you feel secure. But you have to be a little bit careful. Haiti's a little bit dangerous in the larger cities, but the place that we go to, at night you can walk back and forth to the hospital, and you can feel comfortable and protected. But people, they view you different. You're in a community where you're the only white person. You're walking down the street. I mean, you really do stand out. And you can hear people as they walk by, whispering sometimes. They have a little pet names for you. They call you Blanco, or I guess in French, which is fine. But the people are very generous. They're warm and loving. It's amazing how much they appreciate what you do for them.
I was going to say, it must be something for someone like yourself when you come back and then go back again. But it must be incredible, the appreciation that these folks that don't get anything feel.
When I come back, and this is an experience that if you talk to anybody that does mission work, it takes a couple of weeks to get your mind back into American thinking, because you see something that's so unique, and things that are, when you're back at work, are a problem to you or an annoyance. Once you see what happens in Haiti, nothing that happens around here is an annoyance or hard to get through.
General Surgeon Dr. Dan Scoppetta, Bristol Hospital Multi-Specialty Group, heading for Haiti. And, Doctor, it's been just wonderful having you with me today, and I know that my radio audience appreciates what you are doing and what you are going to continue to do, and we are all beneficiaries because of your service and doctors like you who are doing the same thing.